Welcome back to Healthwise. With us is our special guest, Dr. John Kempf, a renowned gynecologist. He kind of laughs when I say that, but I don't know why, because he is.
You know? Just so hard for me to think of myself that way.
So, Dr. Kempf, we were talking about the cervix, you know, and cervical cancer.
Right.
First of all, how prevalent is cervical cancer?
Cervical cancer in the United States is not very prevalent. Because of our high standard of living and a high level of screening that we enjoy in the United States, it's only responsible for about 4,000 deaths a year. And those deaths are actually concentrated in several areas. You find them particularly among Asians on the West Coast because they don't often, just their culture is such that they don't often go. You find it in pockets in the South and also pockets in Appalachia in the North Woods. And it's all related to neglect. Cervical cancer is absolutely a disease of neglect. If you don't get your pap smears done, that you're certainly at risk for developing cervical cancer. Cervical cancer takes 8 to 10 years to develop. If you find it in the very early, even the precancerous stages, you have an excellent chance of just heading off the disease altogether. You don't even have to get it. It's often busy moms who take care of themselves last, and they just find it's easier, and who likes to go for a gynecologic exam anyway, and a lot of excuses, and they don't come. But typically when you find somebody with a cervical malignancy, it's going to be a woman in her 30s with a family.
Wow. Okay.
Yeah. And
what about we talk about is there any particular thing that causes this besides, because we hear some drugs cause cervical cancer? Or
not so much drugs, but there is a virus called the human papilloma virus, also known as HPV. There are 2 vaccines available. It's been a little bit controversial about their use, but again, I think I'm a firm believer in vaccination, and the problems and the side effects are minuscule compared to the benefits that it provides. A lot of parents worry about vaccinating their 12, 13-year-old daughter, thinking that this is going to be interpreted as a signal that it's okay to go ahead and become sexually active. And that's just a matter of parental communication. You explain to them. I don't think it's worthwhile trying to lie to them, because they're not stupid. They will know.
Sure.
And if you lie to them, you lose credibility. So be straight up with your kids when you talk to them about it.
So we're saying that so which age do you think is appropriate for
They're recommending, before they become sexually active, and sadly that's sometimes, 10, 12, 13.
Sure.
So early. Texas has made it a requirement to register for high school, but then again, the company that manufactures one of the vaccines happened to give Governor Perry's son a nice job for $250,000 a year. Another issue, but I do think vaccination is a worthwhile thing. The virus is clearly implicated. It's easy to follow. It becomes a bit of a nuisance for some of the young women who have abnormal paps, and they wind up having to come every 6 months for sometimes 2 or 3 years. But there are a lot of procedures that you can do that won't interfere with the young woman's ability to have her family when the time comes.
Sure.
And it's a preventable disease.
Sure. Okay. Well, the next thing I noticed we were talking about, and we had the ovary and the uterus.
Right.
What are some of the problems that you see?
Yeah, uterine cancer usually isn't that hard to find, but sometimes, again, it's a matter of, denial not just being a river in Egypt. Postmenopausal woman starts bleeding, scares her, she doesn't see about it for a while, and you can have a bad outcome from that. At the first sign of postmenopausal bleeding, if you hadn't had a period for a year or 2 and you start seeing some regular, not heavy necessarily, but just continual bleeding, you need to go see about that immediately. Early endometrial cancer is something that's relatively easy to treat, and the success rate is very good. Moving on to ovary. Ovary is like pancreas. That's the one you just don't want to get. Unfortunately, there aren't any good screening tests for it. Unlike breast and cervix, we don't have a screening test that'll pick up with any reliability ovarian cancer at a stage early enough to make a difference. It's almost always advanced by the time you find it, and the survival rates are dismal. I've had 2 long-term survivors in 35 years.
Wow.
Yeah, it's a discouraging disease. There's a lot of stuff on the internet about getting your CA-125, and tell your doctor you want to have a CA-125 done. Doing a CA-125 is kind of like buying a lottery ticket. You know, if you're lucky, you're going to win. If you happen to be lucky enough to do the CA-125 at a time when your ovarian cancer was still small and treatable, yeah, but that's maybe a few hundred women. If everybody did it, it might amount to a couple of hundred women a year in the United States. And the amount of money spent on all those CA-125s makes it not a very effective screening tool, unfortunately.
Sure. So that's something that you can ask your doctor to do, the CA-125?
Oh yeah, I mean, I'll explain to my patients that they shouldn't really put a great deal of reliability in it.
Because it's only if they catch it when it's
all
small.
luck.
Right,
yeah,
right.
I explain to them it's luck. And some people say, I don't care, I'm feeling lucky, I'm going to go buy a lottery ticket on the way home, I'm going to go ahead and do it. So I don't refuse to do it, but I do try to help people understand that you shouldn't rely on the CA-125 with the same strength that you rely on mammography and ultrasounds and cervical cancer screening and so on.
And another thing, I guess, too, I just want to stress to the audience, and you can validate that, is that and women, I know, especially in this day and age, a lot of them aren't doing the screenings that they should do because of fear. Like you said, it's a fear.
Yeah, and the fear becomes a self-fulfilling prophecy. Use the fear to motivate yourself to go and get the screening done.
Right. Right. Well, okay. Well, Doc, after we have this brief break for our sponsors, we'll come back and we'll talk about some hormone replacement. That's a big thing, I know, for a lot of women in this area, and a lot of women, I think, and like I said, you can validate this. They don't even know they need hormones, you know, well, and I think it's an education thing.
Right. There's a tremendous amount of fear.
Right.
And we'll talk about reasons for that in a minute.
Okay.